The Honourable Leader of the New Democratic Party.
Mr. Speaker, my question is for the Premier. This government promised to fix health care. By every measure so far, that promise has not been kept, and Nova Scotians are experiencing the painful consequences. Yesterday, the Health Authority issued a blanket warning about overcrowding at emergency rooms in all zones. Things have gotten so bad that the government's legislative committee members have begun to hide the Health Authority CEO, or interim CEO, I guess, from the public. And this month's doctors' waitlist numbers are mysteriously late. And so my question is, will the Premier explain what has gone so terribly wrong?
The Honourable Premier.
Mr. Speaker, what I would say is this government, look, there's real issues in healthcare. There's no question about that. Issues around access to care are decades standing, for sure, Mr. Speaker, and they're going to take time to fix, and they're going to take money to fix. But I will assure Nova Scotians that we are committed to making sure they can access the health care they need, when they need it, where they need it. And under the leadership of the Minister and the senior health leadership team and everyone working in health care, we are making changes that will have an impact over the course of time. They'll take time, Mr. Speaker, but this government, in terms of what is really happening in the healthcare system, is the most transparent. We have a whole website where we give out every statistic of what's going on. We want Nova Scotians to know what's happening in their healthcare system, Mr. Speaker, and we are very forthright about it.
The Honourable Leader of the New Democratic Party on her first supplementary.
Thank you, Mr. Speaker. The sad fact is that most Nova Scotians can't access any health care anytime they need it anywhere in the province. Mr. Speaker, the Premier says that the real work is happening, but Nova Scotians aren't so sure. A narrative poll released recently showed that 83% of Nova Scotians rated the quality of health care available in the province as fair or poor. And this is worse than before this government was elected on a single promise. Mr. Speaker, does the Premier know something that patients and their families don't?
The Honourable Premier.
Mr. Speaker, the question around access to health care is something that we're very focused on, because that's where Nova Scotians asked us to focus. We continue to focus there. And we know there are issues. The issues are national for sure, Mr. Speaker. The same survey, if you read into the fine print, it asked people how they feel when they have an interaction with the healthcare system, Mr. Speaker, and it's pretty positive. And you know why that is, Mr. Speaker? Because we have the best healthcare professionals working very hard to provide healthcare every single day. The member opposite would have you believe that nobody is accessing healthcare in the province, Mr. Speaker. That is absolutely wrong. We have a long way to go, but people can get tremendous care in this healthcare system in Nova Scotia, Mr. Speaker. We'll continue to work to fix it. We know there's work to be done.
The Honourable Leader of the New Democratic Party on her final supplementary.
Just to clear up the record, I spent yesterday at the Dartmouth General personally thanking all of the healthcare workers in my community. So I'm not saying anything about the healthcare workers. I'm talking about this government and their efforts to fix healthcare. And Mr. Speaker, one wrinkle faced by many people is the fact that they can't afford the cost of their prescriptions. A survey by Feed Nova Scotia found that 50% of respondents, 50%, didn't fill or collect a prescription for their medication, or had skipped a dose in the last 12 months because they didn't have enough money. When people are forced to scrimp or save and not take important medication, they end up sick, and they often end up looking for health care that isn't there. This summer, when I asked the Premier if he would waive pharmacare fees, he said that I had raised an important question and that he would certainly take that away and look at it, and I'll table that. Mr. Speaker, I'll ask the Premier again. Will he do this one straightforward, specific thing to make sure that people are able to afford their drugs and eliminate pharmacare fees for at least 1 year?
The Honourable Premier.
Thank you, Mr. Speaker, and it is an important, of course, we want everyone to take the prescriptions that have been issued to them by a healthcare professional. Of course, every Nova Scotian wants that, Mr. Speaker. And I will say that, you know, we did a tour last fall talking to healthcare professionals. I know the Minister and the senior leadership team are going to do that tour again coming up. There's a lot that's going on. There's a lot of interaction with healthcare professionals. There's a lot of listening to healthcare professionals. That's something that they're still pleased to have happen. They're not used to it in this province. But we respect healthcare professionals, and we will listen to healthcare professionals, because we know that getting care for Nova Scotians is the only thing that matters to Nova Scotians, and it's a high priority for us, Mr. Speaker.